We believe BioSculpture Technology's Obesity Control Division may offer both the greatest potential benefit to society and the company's largest revenue stream. The usual safe harbor provisions apply to this presentation. 80% of diabetics are obese, but obesity doesn't just cause type 2 diabetes. It causes hypertension, strokes, heart attacks, gastric reflux, autoimmune diseases, cancers, and sleep apnea. 7 out of 10 healthcare dollars are spent on obesity-related diseases. 43% of the population is forecast to be obese in a few years, and 25% of children are already obese. We all know the subcutaneous fat you can pinch with your fingers that comprises 3/4 of the fat in the body. But it is the visceral or belly fat that has gained a lot of recent attention in the press and on Dr. Oz's show, and this is the fat which kills you. The TT scan of the gentleman on the left illustrates visceral or belly fat underneath the muscles within the abdomen, accompanied by hypertension and arteriosclerosis. The CT scan on the woman on the right illustrates more benign subcutaneous fat superficial to those abdominal muscles that can be removed with liposuction. That spare tire about your middle, or the elevated waist-to-hip circumference ratio your doctor may measure, is a risk factor for the metabolic syndrome that occurs in 80% of obese patients. It happens because that elevated ratio is a good indicator for visceral fat. The syndrome is associated with high blood sugar, hypertension, and a bad lipid profile. It is associated with type 2 diabetes mellitus and coronary heart disease. Metabolic syndrome happens because visceral fat is a noxious hormone factory. It secretes cytokines or cellular hormones which cause hypertension, type 2 diabetes, arterial clotting and narrowing, and inflammation, autoimmune diseases, and cancers. But it also secretes neuropeptide Y, which is the most potent hunger hormone known that acts directly on the brain. It is what makes it so difficult to stay on a diet to lose weight, and why you so frequently regain weight after you have lost it. Current bariatric surgery procedures are either restrictive, forcing smaller intake per sitting, or bypass, shortening the transit time of food through the gut. Both succeed by decreasing absorbed calories, but both decrease absorbed nutrients and vitamins as well. Even though endoscopic techniques have made these procedures 30% safer, cutting into the bowel, rearranging the body's plumbing, or leaving behind a foreign body expose the patients to serious risks and complications. These include fatty liver, kidney stones, erosions, esophageal dilation, port problems, pulmonary emboli, diarrhea, and death. But in addition, sequelae or unavoidable consequences may involve serious quality of life compromises, such as not being able to eat a normally sized meal, not being able to belch or vomit normally, having to eat frequent small meals, diarrhea after eating, fatigue, anemia, easy bruisability, and poor healing. Lap-Band reported $160 million last year, coming from sales of $2,500 Lap-Band kits for each procedure. We plan to offer a similar single-use $1,700 consumable with an 84% gross margin in conjunction with our EVL device. But our patented endoscopic removal of visceral fat will not require leaving behind a foreign body or cutting into the bowel. Furthermore, patients having current bariatric alternatives eventually stop losing weight or plateau. Many even start regaining weight as the body adapts. EVL can be repeated so there will be no plateau. For each portion of visceral fat removed, the body will lose a much larger multiple of body fat, taking the patient down to lower and lower weights until you reach their ideal weight. We've been awarded 2 method and device patents for removing visceral fat with our twin cannula-assisted lipoaspiration technology. Having a method patent allows us the option of licensing bariatric centers. We've also been awarded a 3rd patent for our sampling and processing technology of aspirated fat to determine which is the most metabolically hazardous fat that the surgeon should target for removal first. There are currently 9 other pending patent applications. You can review our patent allowances and patent applications by doing an inventor search on patentbuddy.com and entering QSIN. BST has an exclusive, paid-up, royalty-free, perpetual license of everything you see. We plan to bring the EVL device to market as substantially equivalent to our current twin cannula devices for the precision removal of head and neck fat and abdominal sculpting and six-pack etching without the risk of burns. While immediately generating revenue from this device and its wand-like embodiment we will also introduce into liposuction as Airbrush LipoSculpture 2E, we'll then go after the additional indications of visceral fat removal and the specific indication of treating obesity, metabolic syndrome, and type 2 diabetes. Management is more than capable of making this happen. I'm Bob Cusin, a Cornell-trained, board-certified plastic and general surgeon who founded the company and serves as CEO. I invented both power-assisted liposuction and twin cannula-assisted liposuction and have 15 allowed patents. I've performed both human and animal investigational studies in the university setting, published 3 books and over 24 peer-reviewed articles. My toolset includes being an IP and licensing attorney duly admitted to 3 state bars, and being a life science sector research analyst with a Columbia MBA. Debbie Salerno brings 30 years experience in the finance and security industry to the company and an intimate knowledge of pipes, going public, and alternative public offerings. Ralph Persino, our Northeast sales manager, brings his 35 years of medical device company experience introducing new products. He did this in his own company, Squibb, McGann, and Instrument. Peter Ciricelli brings his Stanford PhD and his experience heading new product development at GE and BAE West. He has 4 patents under his own belt. Simon Taylor is another Columbia alumnus and a Harvard-trained attorney specializing in startups and ramp-ups. Thomas Perkowski prosecutes our patents and makes life easier by filing our motion control feedback circuits and algorithms by his being also an electrical engineer. Brigadier General Yules is our Washington connection, as he's been before Congress for each of his 4 stars. He's also a board-certified surgeon affiliated with Harvard who sits on the board of several public and private companies. All 3 are investors in the company. Jack Miskunis is another Cornellian and brings us his investment banking and investment advisor experience with his Boston University MBA. He's specialized in healthcare and biotechnology companies and is also an investor in the company. We believe we have the ability to both offer a solution to the 1.3 billion obese patients suffering about the globe and be extremely profitable at the same time. As escalating obesity costs are bankrupting the healthcare system with no end in sight, we believe bringing this new treatment to market in these patients should have the highest possible priority for both financial and societal reasons. Thank you for listening.